People do not need a lot of equipment for cardiovascular exercise. There are various cardio workouts a person can do at home with no or minimal equipment, such as marching or jogging in place, dancing to music, mountain climbers, and burpees. The American College of Sports Medicine says we should get 150, 300 minutes of moderate exercise every week. That's like 2.5 to 5 hours. They want us moving around at least a little bit most days. And you can do cardio almost anywhere at home, the park outside, whatever. You can choose the exercises that suit their current fitness level. They could also move on to more difficult movements over time as their fitness improves. The following are calorie-burning exercises that a person can do at home with minimal equipment. These exercises can form a cardiovascular exercise program. For example, a person could do each exercise for 45 seconds to 1 minute, rest for 30 seconds, and move on to the next set. As their fitness levels increase, people may wish to perform these exercises in circuits. To perform circuits, a person completes 30 60-second rounds of each chosen exercise in succession before resting for 30, 60 seconds. They then perform the entire course again as many times as they prefer. So what kind of exercise helps your heart work more efficiently? 4 types of heart-healthy workouts. Pretty much all exercise improves your heart strength and health, but the fastest way to improve cardiovascular health includes a variety of exercises that work your heart, build muscle tone, and improve flexibility. Below, I will share you the most powerful 4 types of heart-healthy exercises and how much you need of each. 1. Cardio for heart health. So cardio is probably the first thing most people think of when it comes to exercise. Cardio is basically anything that gets your heart pumping faster, makes you breathe heavier, and works up a sweat. The real question is doing cardio even worth it? Heck, yes, it is. See, your heart is a muscle, and just like any other muscle, working it more makes it bigger and stronger. And when your heart muscle gets stronger, it doesn't have to beat as many times to pump blood all around your body. And some studies show that with regular cardio, you could lower your resting heart rate by 20, even 30 beats per minute. That saves your heart from beating millions of extra times over your lifetime. With all those saved heartbeats, your ticker stays stronger for longer as you get older. So better heart health in the long run. Here's the kicker though. Cardio doesn't need to be at the gym or require any fancy equipment. Here are some examples of good cardio workouts. Walking. Walking is enough exercise for most people if you do it briskly every day. Getting your heart pumping faster is what makes it good for your heart. You can check if your stroll counts as cardio by seeing if your breathing changes. And if you can still sing while walking, it's too easy and won't give your heart all the benefits. But it's better than just sitting. To get a walk that counts as a real workout, it helps to act like you're in a hurry to get somewhere. When I start breathing harder, but can still talk, I know I've reached a good pace. If you find yourself short of breath, you might be overdoing it. Ease up if breathing gets too difficult. Improving your heart health isn't worth passing out. The goal is to challenge yourself, but not go overboard. Check your breathing and pace yourself. Cycling or spinning. Riding a bike or cycling is good for your health in lots of ways. Studies show it can help lower your risk of heart disease and give you a mental boost too. Most beginners bike around 10, 12 miles per hour on average, so you don't got to go too fast for it to be good cardio. Just make sure to wear a helmet if you're biking outdoors so you don't hit your head. Protecting your noggin is important while you strengthen that ticker of yours. Swimming. Swimming's an exercise that works your whole body and builds both strength and flexibility, all while getting your heart pumping. It burns a ton of calories too, so it rocks for losing weight. Since it's low impact, swimming can be good for folks with arthritis or joint issues. And if you're just starting to swim, I'd say take it easy at first. Maybe swim laps for 5, 10 minutes to start, then build up your endurance over time. No need to rush into cranking out hours in the pool right away. Listen to your body and don't push too hard. Interval training. Interval training is different than your usual cardio workout. Instead of just steadily biking or running at one effort level, you mix in bursts. Crank that resistance up for a minute, then ease off and walk briskly for a stretch. Some gym equipment handles this for you, but you can also DIY. Here's one approach. Push hard until you're breathless, maybe a minute if sprinting or half the length of the gym. Then slow to a walk and catch your breath for a similar time. Keep swapping like this for the workout and the benefit. You can tick off your daily exercise in less time since those intense 1-minute bursts count double compared to steady-state cardio. Think 20 minutes of this style of coaching is equal to a 30-minute jog where you don't spike your heart rate. The second exercise type is strength training. Turns out, lifting weights regularly can be super helpful for your heart health, not just doing cardio and aerobic exercise. One big study looking at almost 13,000 people found that hitting the weight room weekly was linked to a 40 to 70% lower risk of developing issues like heart disease or even having a heart attack. Even if they weren't doing any cardio, your heart gets the biggest benefits when you combine strength training and cardio. But strength training alone still gives your heart a good workout. When you lift weights, the movements are slow and controlled, but it still ends up spiking your heart rate and blood pressure more than if you just went for a jog, which is great because it means you can get the heart perks without having to spend hours at the gym every day and pay attention to when the exercises start feeling too easy. At first, maybe you can only do 5, 10 reps before needing a break, but as you get stronger, you'll breeze through more reps and sets. That's when it's time to add more weight or reps. It's a sign your body and heart are getting even stronger. Moderate weightlifting. If you're someone who goes to the gym just for cardio, it's pretty easy to also get some strength training in. You can tack on a few extra minutes at the end of your normal workout to do some weightlifting. It doesn't take much time, but will make a difference. And some good areas to focus on with weightlifting are your arms, back, core, and legs. Throwing in chest presses, shoulder presses, tricep extensions, and bicep curls will cover your arms. For your back, try lateral pull downs and lower back extensions. Crunches are always good for strengthening your core. As for legs, leg presses, leg curls, and calf raises hit the major muscle groups. Now, if you're totally new to working with weights, I'd suggest starting slowly rather than jumping straight into intense lifting right away. Strength training at home. You can actually build strength without leaving your house. No fancy gear required. Just use stuff lying around, like bottles for weights or resistance bands. Focus on body weight moves that work major muscle groups like squats, push-ups, and planks. Check YouTube if your form needs work. A few simple exercises done right can make you stronger. 3. Exercises to improve flexibility and balance. Stretching and balance exercises can reduce the mind and body stress that can affect your heart in a big way. Plus, flexibility and balance make it possible to do the cardio and strength training exercises that you need for heart health. Warm-up stretches. Before starting cardio exercise, spend a couple minutes stretching the muscles that you'll be using. So if you'll be running, stretch your legs and hips. If you'll be shooting hoops with your pals, work in some shoulder stretches. Yoga. Yoga provides way more benefits than just flexibility and balance. It's become hugely popular as an all-around activity for complete health and well-being. Some of the other major perks include helping you chill out and be more mindful, and it lowers stress and anxiety. Studies found it also helps heart patients rebuild their capacity for exercise and get back quality of life after dealing with failure. Cutting your risk for heart disease, especially if you've got metabolic syndrome with high blood pressure, blood sugar, too much fat around your middle, and crappy cholesterol or triglycerides. Making heart rhythm issues less common for peeps with atrial fibrillation. Most types of yoga don't replace the need to get your cardio on, unless you're doing a cardio yoga class that mixes in stretching with moves that get your heart rate up. The thing with those is they might not relax you as much. It's worth making time for yoga even on days when you're not doing hardcore cardio, or throw some poses in as a warm-up before a bike ride or cool down after a run. 4. Movement throughout your day. Sitting still for long periods can be damaging to our health, even if we make time for regular workouts. New research indicates that taking short activity breaks throughout the day has measurable benefits in reducing heart disease risk, and it's easy to lose track of time when absorbed in work or entertainment. Before we know it, hours have passed without standing up. While momentary actions like letting the dog out don't constitute real exercise, they add up over time. Studies confirm that consistent physical activity is vital but insufficient on its own. Prolonged inactivity escalates risks for obesity, high cholesterol, diabetes, and more. So be mindful to interrupt lengthy sedentary spells. Set alerts to remind yourself to stand, stretch, or stroll around a few minutes each hour. Protect your well-being through conscious, frequent motion. Standing at least once an hour. Sitting too long just isn't healthy. If you're parked in your chair all day, be sure to take little walkabouts every 60 minutes or so. Some of those fancy fitness gadgets actually have reminders to get up and move when you've been static for ages. But even without the beeping and buzzing, you can still find ways to shake a leg now and then. Next video call, stand up and pace and take the long way to the kitchen when you need a caffeine fix. Tiny bits of exercise throughout the day can really add up. Step up daily activities and chores. Tracking your daily steps can show if you're active enough. You've probably heard that 10,000 steps is the magic number, but some research says even 7,500 steps per day, especially if some are faster, get your heart pumping ones, could be good enough. And even just running errands or doing housework gets you moving more than just sitting, and that matters for your health even if it doesn't feel hard. Things like vacuuming or yard work can be almost like a workout if you're healthy enough for them. But be careful with vigorous stuff like shoveling snow. It can put too much strain on your heart. The main thing is to move around more during your day instead of just sitting in one place. Track your steps if it motivates you, or just find ways to get off the couch and be active without thinking about numbers. Either way, a little bit of movement all adds up.